The United Nations Fund for Population through the Embassy of Japan received funds to support the implementation of a one-year project intending to avert human suffering and restore dignity among refugee and host communities.
Or GBV is that we are committed to support in the areas protecting the rights of women and children consistently and continuously. Sometimes these are not prioritized, especially under the emergency circumstances.
At least 132,000 people have been reached, including refugees and Ugandan nationals, with universal access to quality, integrated sexual and reproductive health services.
That is really strengthening referral systems and ensuring that pregnant women are able to access health facilities in a timely manner.
A senior medical officer in charge of Kamwenge refugee settlement, Dr. Apon Raphael, says this health-sensitive project is vital in reducing mortality rate.
Because these teenage mothers have challenges from basic things like breastfeeding, breastfeeding, how many times should you feed the baby in a day? How do you go about this when the baby has this challenge? How do you go about it? So we've been able, with the support of other partners, to make sure even once we discharge them from this unit, we are able to help them to raise those children. Even with their limited knowledge and being young and facing all these other social stressors too.
The project overview indicates 82% of health facilities in targeted districts have two special trained officers in emergency obstetric and newborn care and clinical management of rape cases.
To provide birth control methods, we're able to offer family planning, we're able to offer condom distribution, among other things.
The trainings about the maternal perinatal death surveillance.
To sustain achieved objectives of the project, the district is constrained with available resources to absorb polished health workers.
Analyzing the wage we have, and then because the gaps are there, but the issue is the wage. But we are discussing it further with COW and other stakeholders to see how many we can absorb.
In the implementation of this project, women and youth centers have been established to create awareness of matters of sexual reproductive health and gender-based violence.
I've gained at least a skill. We have been impacting the training in groups. We divided them into subgroups.
We are having hairdressings. Here we are having bakery. And in the bakery, we are doing chapatis, we are doing mandazi.
The project was implemented in refugee hosting districts of Kamwenge in Kamwenge Refugee Settlement, Isingilo in Nakivali, Ichegegwa in Chaktu, Kikube in Changwali, and Lamo District in Palabek Refugee Settlement. Abdul Nasile Luwama, UBC News.